Morning, Madam Chair and Commissioners. So here's our weekly reported cases that's been updated from last week, and we are starting to see a promising new trend of both not as much as a data lag as we had been seeing, but also our case numbers appear to be going in a downward trend. So for the 23rd through the 29th, we had 680 new cases reported, and then last week, the preliminary number is 299 cases. Statewide in Minnesota, for the 23rd through the 29th, we had a little over 38,000 new cases, and then last week, the preliminary number was a little over 13,000. We also are seeing the same trend in Cass County and throughout North Dakota as well. And then this is the reinfection data. So continuing, as expected to see this number increase week to week. So for Clay County, we've had 765 reported reinfections. Statewide, we've had 53,380 reinfections, and for the state of North Dakota, 11,434 reinfections. And again, the definition of a reinfection is a person is counted as having a reinfection if they've tested positive for COVID, and then again, more than 90 days after that initial infection. And then this is the Clay County cases reported per week by date of test. So we're, again, hopeful that maybe we had reached the peak the week of the 9th, where we really had that huge spike of cases, where we had over 1,500 cases reported during that week, a little less the following week, 680 cases reported the week of the 23rd, and then again, the preliminary number for the 30th the week of the 30th at 299 cases. And then this is the epi curve, so cases reported per week since the beginning of the pandemic. So you can really see the waves that we've had throughout the pandemic, and again, that huge spike in cases that we saw in January, but hopefully we are on a downward trend. We'll see as the next couple weeks happen if that continues. And then this is Clay County cumulative cases broken down by age. So the age group with the most amount of reported cases has been in that 20 to 24 age group. And our total cases now are at 18,291. And this is the updated graphic from the CDC, just showing the level of community transmission across Minnesota, still at that high level of transmission, as we've kind of been stuck at that level for a while now. This is Clay County deaths per week due to COVID. We did unfortunately have one more death reported, so we're at 117 deaths throughout the span of the pandemic. Clay County hospital admissions per week. We saw a big spike 2 weeks ago, and then we were starting to see those numbers trickle down. So last week we've had nine reported hospitalizations so far. Again, that number may increase as the data catches up, but nowhere near as high as it had been a couple weeks ago. And then this is our hospital capacity information for our local healthcare systems. So we had 7 adult staffed ICU beds available at the time of this report, and 1 staffed ICU pediatric bed available. Statewide totals, we had 16 adult ICU beds available and 2 pediatric ICU beds available. And then the North Dakota hospitalization data, we are seeing a downward trend on this as well. So there's currently 153 hospitalized with 15 in the ICU. That is down a little bit from last week. I think there was 184 hospitalized last week with 20 in the ICU. So those trends are also going down. And then this is the vaccine breakthrough report that we provide every week through the Minnesota Department of Health. On the left side was our cumulative percentages as of last week, and then on the right side is this week. So 9.697% of breakthrough cases that we've seen in Minnesota, and then breakthrough hospitalizations and deaths remain very low at 0.25% for hospitalizations, and deaths even lower at 0.045. So still seeing very, very strong protection against severe disease with these vaccines.
Do we have any board questions?
I can wait till she's done.
Okay, thank you.
And then this is just the updated graphic that MDH puts out, just really showing the difference in deaths that we're seeing in Minnesota compared to the fully vaccinated compared to the people that are not vaccinated. So again, the blue line is those that are not fully vaccinated. The green line are those that are vaccinated. So you can see there's a huge separation of data there. And then this is a graph that I had showed last week too, just showing the distribution of variants throughout Minnesota. So you can see where Delta and Omicron intersected, and now Omicron is really the predominant variant. So 98% of all specimens that are sequenced now are Omicron. All right, before Jamie talks about vaccine data, is there any questions?
Commissioner Campbell.
Becky, on the vaccine breakthrough report, the breakthrough cases, that represents being fully vaccinated and the booster, or just fully vaccinated?
So at this point in time, just fully vaccinated, as long as it's been at least 2 weeks since you've had your final dose. To my knowledge, they haven't started breaking apart those that have been boosted versus fully vaccinated.
Okay, that would be an interesting piece of data.
I agree. If we can get that, I will share that.
Okay, because I would think that that's going to either make the case stronger for the booster or.
Right.
And then I like to kind of find some good news in all of this, and I look at the chart with the Clay County cases per week. My first question, though, is, and I believe it was Commissioner Cayley last week, asked a question about the delay and how long, how much that changes. So, for example, on the week of the 23rd, we had 680. I'm on the weekly. Yeah, there you go.
Okay.
So, when you were here last week, did that number change, or would?
It did. So last week at this time, we had reported for the week of the 23rd that there were 597 cases.
Okay.
So, I mean, it's gone up about a little over 100, I guess, but way less of a data lag than we had seen in weeks previous where it had doubled or even tripled.
Okay. And then, so again, that 299, that's preliminary, but we can assume that will go up a little bit.
Correct. Yes.
Okay.
Yes.
I just was doing a little bit of math here, and from January 9th to January 30th, we've, based on the 299 now being the number, that's an 80% drop.
Right. Yes.
That's,
As long as there's not a data lag.
it's kind of nice to get some good news out there once in a while that this thing is really, seems to be going in the right trend.
Yes. Cautiously optimistic.
Thank you.
Anything else? Okay, Jamie.
Look at the vaccine data and the testing information. So first of all, the first slide, looking at vaccine data across the state as of 2/3/2022 for all those 5 and over. And the people with at least one vaccine dose, we are at 73.9%. And those who've completed the series at 69.3%. And then just over 2 million have had a third dose or a booster administered during that time. Clay County continues to more than likely be underreported, but looking at the Minnesota COVID site, we're showing 60.6% for those 5 and over fully vaccinated and almost 66% with at least one dose. So we're assuming it's a little higher than that, but that's where we are. And then if we want to go to the next slide there, looking at the doses administered by Clay County Public Health, you can see that it gets to be lower and lower amounts. So just 29 doses. Sorry, I can't read it. How many?
38.
38 doses last week, and a total of 19,141 doses were administered by Clay County Public Health alone. And then the next slide, see what we have planned for this week. So we have, or for last week, 38 doses total. The first doses, we gave 3, second doses, 3 doses, Third dose, booster dose 27, and then the pediatric breakdown of 5 to 11, 4 first doses and just 1 second. So each clinic, we continue to provide all of the vaccines to all of the age groups that are eligible. And then looking at our plans for this week. So first of all, we have two clinics on Wednesday, just one posted on this slide here, but we will also be at Concordia at the Knutson Center. We were invited there from 9:30 to 1:30, and we will be providing Pfizer for 12 and over for second and booster doses, Moderna 18 and over for first, second, and booster doses. And then our clinic in the Family Service Center will be from 3 to 5 p.m. for 5 and over. So for those, Moderna for those 18 and over, first, second, and booster doses. For the 12 and over, Pfizer first, second, and booster doses. And then for those 5 to 11-year-olds, the first and second doses. I'll also mention that we had our preliminary planning discussion about the 6-month through 4-year-olds. MDH is reaching out and asking our capacity, and our team plans to continue to provide that vaccine through the Family Service Center when available. So we will be preparing for that. And we'll continue to provide the other vaccines. As long as people keep coming in, we will do that. We did have our clinic last week in the public health clinic, and we will do that again this morning just because of our low numbers. We had 20 people registered yesterday, so we can handle that in our with less staff and in our clinic. So that'll be our plan for tomorrow as well. And then the next slide, we'll look at the testing, so Vault testing site data. And Becky put this graph together kind of just to give us a percentage, looking at the positivity, right? But we also have the vaccine report from them as well. So for the week of January 23rd, 23%, which was down a little bit from the previous week, which was 27.5%. And that has been our highest last week, was over the last 4 weeks. And then just to, I did take a look at the Minnesota COVID site, and they're still posting that Moorhead COVID site as the same days and same hours, I'm sorry to say. But it is still the Monday through Thursday, 11 to 6. Closed on Friday and Saturday, and then on Sunday from 11 to 4. And they are offering the rapid test or antigen test for anyone 2 and over, and also the PCR test as well, so that's lab confirmed. And I guess I just checked that again last night to just make sure there weren't any changes, and that's what they're posting. So then looking at our report, the left-hand side of this is the only thing that seems to be moving, but basically through the week of January 23rd, number of tests that week, 2,354, with 550 of those positive, and the 23.36% positivity rate. And they are not giving us the breakdown of the rapids and the PCRs anymore. Any questions about that or comments about that?
Commissioner Campbell.
Jamie, I have one question for you. I've heard from some people about the rapid test where they might take that 1 or 2 times and it's showing negative, and then all of a sudden they get a positive one. Do we know anything about the accuracy of those rapid tests?
Well, what we know is that the rapid test is most accurate if you have symptoms. So they recommend the PCR test if you are not symptomatic. So, and it's a snapshot in time. So if you do a rapid test and it's negative now, but if you do it again. But anytime you get a positive test, our epidemiologists are telling us it's a positive. So
Do they know, do they see too many false negatives?
False negatives are going to be more likely if you don't have any symptoms and you do a rapid test. So.
Thank you.
Commissioner Gross.
A question, when you have these clinics and stuff like that, you have to have all kinds of vaccines ready there. What happens to all the extra, we must have extra stuff there. How long do you keep that, or what?
You can't keep it, it's a very short turnaround, 4 to 6 hours. And so what we do is we reach out to the corrections facilities, to the juvenile detention center, to the homeless shelter. We are going to homes of homeless people. So we do that at the end of every clinic. But there was an information that really came out from CDC yesterday that said they really want us to stop worrying about wasted doses. There's plenty of vaccine. They would rather we gave 1 dose to a person, especially children, that needs to be vaccinated, even if there is waste. So they're pushing us to continue to use that vaccine that we have. And again, once at the end of our day, it's not any good the next day, but they're saying if someone comes in and wants just 1 shot, we should do that. We should serve them because there's a lot of vaccine available. So, but otherwise, that's what we do. We run around the community and try to use up those doses, and we've been doing that since the very beginning.
Commissioner Kaylee.
Becky, a few weeks ago, you talked about what the booster does in our bodies and the importance of that. I was just listening to an interview with Dr. Fauci, and he was talking about how the vast majority of the population that was planning to get their first and second doses has done so already. And so now is a good time to start focusing messaging on the boosters. So I was wondering if you could talk about that again, the importance of the booster and what it's actually doing in your body.
So the booster dose is, it raises your neutralizing antibody levels. So after a period of time, usually 5 to 6 months, we're seeing waning immunity after the first 2 doses or 1 dose of J&J. So it's really just helping to raise that antibody level, which is kind of like our first line of defense when we're infected with the virus. Does that kind of explain what, and especially if you're at high risk for serious infection, the booster is really, really vital.
I think you said last time there's a couple different kinds of immunity cells. Yep, and so there was that first line of defense, which is really boosted with that booster, and then there's the more long-term ones. Can you talk about that briefly?
Correct. Yeah. So we have, the immune system is incredibly complicated, and there's many, many, many different types of cells. But in essence, yes, there's that first level of defense, which is our neutralizing antibodies, which is what the booster dose is helping to raise. So it helps you to really reduce serious symptoms. But then the second line of defense is our T cells and B cells. So those are the memory cells. And that's what keeps people out of the hospital and from dying. So you might wind up getting a breakthrough infection, and over the course of a couple days, your body is able to fight it off.
Do we happen to know what rate of our population that was fully vaccinated has gotten their booster shots, where that is at?
We do not have that data.
Then my last question, you brought up the kids under 4 and under, which I happen to have one at home. Is there an expected timeline for when that will receive emergency approval?
So it did just go to the FDA, so then the next step is to go to CDC and before it becomes approved. So the timeline, I'm not sure exactly, but the fact that Minnesota is asking us if we are prepared and can respond, hopefully that will be soon.
Thank you.
Yes. Thank you. Commissioner Ebinger.
Just looking long-term, we've gone through the booster phase. Do we have an idea how long the efficacy of that lasts and what the projected tactics that we're going to employ after that? Is it going to be an annual booster, or do you need to go through the whole series again, or do we have any idea where we're going?
I don't think I've heard anything real specific unless you have, Jamie. I think one of the general thought processes is that it likely will turn into a yearly vaccine that you would get, like the flu vaccine. It may wind up turning into a 3-dose series to start with for people that have never had a COVID vaccine, but I think, time will tell on that.
Thanks.
Thank you. Circling back a little bit to the vault testing and hours and availability, I know when Representative Keeler and I were on the call with the governor's office and MDH, they really stressed their inability to provide service there over 40 hours, and that was really the hang-up to adding additional hours. They're not even open 40 hours. So I think that, one, I'm glad to see that the trends are downward in terms of positive numbers within the community, and also see that there was a rise in tests administered at the vault site, but I still still really do believe that an earlier option for testing would be in our best interest. And I know that Mayor Carlson and I will probably be reaching out to Kathy towards the end of the week, I think, to circle back and re-advocate for adding an early morning option, even if it was just a Monday morning and then maybe a Friday morning. But I'm disheartened to hear that even though the locals on the ground are really trying to add availability, it just is falling on deaf ears. That's just frustrating. But my soapbox will be removed now, so. Anything else? Commissioner Ebinger?
Have we ever heard from Vault executives? They said they were going to be contacting somebody with the county. Has that happened?
Vault executives did come to the site without reaching out to Clay County Public Health. Thank you. Anything else? Anything else? All right. Thanks for your work. We appreciate it.
Thank you.